I would say run, don't walk, and get the help you need to regain your health and your happiness.
I knew that I needed a team that I could work with, and being introduced to Amy, she really cared. She really seemed like she cared about my health.
So when you come to me, I'm going to walk through and say, hey, let's get to know you. Let's get to know all of your medical history. Let's get to know your past successes and challenges and figure out an individualized care plan that puts together all these comprehensive approaches, including the medical and the science, the nutritional component, the behavioral, and then the physical activity, which a lot of people get scared with, but trust me, that's key for maintaining, not for reducing. We know that there are over 200 obesity-related complications. So I want to say when I meet someone, how can I make you better? How can we treat one disease and make multiple disease states better? So it's really this whole person care approach with them. So for many of the patients who come through my door, they've tried the lifestyle, the weight's come off, but then they've regained it because the body's fighting back and they're getting very frustrated. So I really want to work with them to say, okay, hey, let's take a look at what's worked in the past and let's realize there's science behind it. I am here to work with you to help you to understand why you've struggled and for you and I to work together to figure out what the missing link has been, focusing on both the science and the lifestyle piece.
I was in a lot of pain from my hip. My health was questionable. I was class 3 obese and really unhappy. Doing the best I could to put one foot in front of the other every day.
In 2015, I had a severe stroke. While in the hospital, I find out that I have stage C heart failure. In the process of all this, I'm having severe knee pain. So I contact my doctor and my primary care referred me to Dr. Schmidt.
I had come to see Dr. Hartzler with OrthoArizona for a very bad hip. I was losing a lot of mobility, and in the process of Dr. Hartzler and I trying to decide how to treat it, I brought up the subject of my extreme obesity. He said, we could help you with that if you're interested, and I said I absolutely am. So he referred me to Amy.
Dr. Schmidt and I sat down and we discussed my knee, and he felt that we should go ahead and take the next step, and he referred me to Amy Ingersoll.
Amy is different than anyone I've ever met. When I first was referred to her, she sent me a very extensive and well done patient profile to complete, and I did it, and she clearly read it prior to my first appointment with her.
We discussed the things that I was eating and how I could change that. And we discussed my medications and what medications were actually holding weight or putting weight on me. We changed those medications, and she immediately did blood tests on me and found out that I was diabetic, and I was put on diabetic medications.
She talked to me quite a bit about depression, anxiety, and she made it very clear to me that I was not going to be able to help myself successfully in my weight loss journey, and she was not going to be able to help me unless I was willing to address my issues of anxiety and depression with her, which I enthusiastically did. Most reassuring and encouraging with Amy is that she is 100% current in the field of obesity management. She takes a very scientific, data-driven approach to weight loss. It allows the patient to concentrate on the fact that obesity is a lifelong medical condition that requires lifelong management.
My weight was at 375 pounds. I've lost over 120 pounds. I'm very active. I go to the gym now.
Meeting Amy made me realize it's something I could do. I did it. As of today, I've lost 105 pounds. I am active. I exercise every day. I am traveling again. I hadn't traveled in years because I was worried about airplanes and airplane seats.
I'm able to walk my dog. I can get in and out of a car now. I had a very painful knee experience, and my heart is stable. My doctors are all very, very, very happy with me, and just very thankful. Very, very, very thankful to be where I'm at today.